Good afternoon, and welcome to our bite-sized booth talk on how to maximize resources on quality and risk teams. I am Maria Mann. I'm the clinical product manager here at Arcadia.
I'm Melissa Merenda. I'm the Senior Product Manager.
Our objectives are to discuss strategies for building successful risk and quality teams, to review recommended workflows and focus areas for risk and quality teams, and to share tips for success and best practices to help your team reach your organizational goals.
So, building out your team is the first step. You want to define goals and objectives for the team, different roles for the team, what responsibilities they're going to have. And you want to also make sure that you're not just defining larger overall goals, but breaking those down into small subsets so that you can track your progress over time. And then you can get those little mini wins before you meet your overall objectives. You also want to develop a really good communication strategy, whether that's within your network, within your own teams, to prepare them for those changes and to make sure that everybody's on the same page and ready to jump in and that everyone's aligned on the different goals and objectives that you set for the team.
Early on, you want to establish how you're going to measure the success of your team. So you're going to establish performance metrics. To do that, you're going to want to have metrics related to your program, your overall program. So things like RAF capture, recapture rates. You also want to have provider metrics. You may offer some sort of incentive for providers, and you need metrics in order to do that. And you're going to also want to measure productivity of your team members. So you need to establish early on how you're going to measure the success of your team. You also want to define your focus areas. What are you going to be working on specifically? Is your team going to do risk? Is your team going to do quality? Is it going to do risk and quality? And what lines of business are you going to cover when you're doing that? And then identify tools and workflows to be operationalized. So are you going to use, for Arcadia, are you going to use Assess for your team? Are you going to use Patient Chart? What reports are you going to have? So you need to have that established early on. When we talk about workflows, we're talking about basically a timing of when you're going to do the review. Is it going to be prospective? Are you going to do the reviews or have your team do reviews before the patient visit so that you can capture all the risks that were, or recapture all the risks that have been captured previously, or identify documentation opportunities that you need to present to the provider before that patient actually shows up? You can do a concurrent review. That's more of having the review occur within the first 48 hours of the visit. And then the retrospective review is when you're going to identify things that may have been missed or things that you need to train your providers or your team on better. You don't have to do these mutually exclusively. You can actually do them, have more than one workflow. So you can do a prospective program as well as a retrospective program. There are very successful risk teams out there that do prospective reviews only. So they only touch the chart one time, they do the prospective review, and then the next time the patient comes in, they can see everything that was missed by doing the next prospective review.
And these workflows that we're showing you too can vary depending on the size of your team. Some people have one person that's their quality team. Others have, embedded people within the practice or people that work specifically with your practices. So some of these workflows can be tailored. If you can't do all of them, you can eliminate, a couple of them, just use one or two. But these are some common quality team workflows. So gap list and review and patient outreach. So who has a gap? Do they have an appointment? Are they coming in this week? Are they coming in the next 2 weeks? And getting that chart prep so that when the patient actually comes in, the provider just has to review that, or that order is already placed in the chart, but they just need to tell the patient to go. One other piece that's really important and I think gets a little bit lost is closing the loop. So we're putting those orders in, we're attempting to close the gaps, but also then going back and making sure that you've actually followed up with the patient, they went and they got the test. and having a workflow to kind of monitor those types of things. And then making sure that you're communicating with the teams that you're working with, not just the teams that are setting the goals and the exec level folks, working with the providers and their support staff towards your overall goals that you set or your mini goals. And if you're honing in on one focus area, like say you want to just improve A1Cs, that's your worst measure, really focusing on a plan for that and those mini metrics for success over time. So if your end goal is, you want to be at 15% and over time, right, you're at 30%, maybe for the first quarter, you want to improve by 5% so that you're getting small wins along the way. And then you can also keep track of that in more real time if you're checking in and talking to those different providers and support staff about remediation plans or like what's working, what's not working, and pinpoint that sooner before the reporting period's over.
So tips for success: you need to foster collaboration and communication. This needs to be bi-directional communication between your leadership and your teams, between your teams and your providers, between the teams. You may have a CDI team and a risk team, or a coding team. So you need those members to communicate. So communication, you need to develop a nice communication plan. That is going to be the key to the success of your program, because you have to be able to give feedback or see where the opportunities have been missed. You want to invest in technology. You want to make sure your team is efficient and you have a technology that can help streamline your process for getting the work done.
You're also going to want to leverage data. So using those tools to get a good insight into where your gaps are, what are those loops that you need to close, and then also break up your plan. So you have your big overall plan, and again, small chunks, small metrics to achieve some success, so people feel like they're actually progressing. And if you don't feel like there's going to be adoption, implementing one thing at a time, get them to do that, and then add a little bit more.
Any questions from anyone?
Do you have a recommended size of a
So the question is, do we have a recommended size for your team? It really depends on the size of your organization, what your plan is. If you want to have somebody embedded at practices, that is, central, or if you're going to leverage an existing person and identify them as like a champion at the practice. So I think there's a lot of flexibility on how you structure your team, depending on the size and budget of your organization.
Definitely want to take into account the number of visits per year, because you're going to want people to be able to cover those visits.
And how many groups you actually have to work with.
Right.
Not maybe you just want to start working with low performers if you don't have enough resources to work with everybody on every single thing. Yeah, so the question was to elaborate a little bit more on making those mini goals working towards your overall goal. So it's important because you want to keep the teams that you're working with motivated, and the providers. Sometimes they feel like they're just jumping through one more hoop, and this actually makes them feel like, I would feel like that we're progressing and I'm not doing this for just no reason, or if you're working with them and communicating with them, you can also tailor it to what works for that group, what's going to get them to do those things that you need them to do. And I think, obviously the overall success at the end is usually the payout. So,
right.
And obviously good care for your patients.
Mm-hmm. And the feedback, the positive feedback, if they're actually doing the work and they
keeps them engaged.
Accomplish a mini goal, it keeps them engaged. So that's where you definitely need your providers to be engaged. A disengaged provider can ruin, a lot of success that you've made in the structure of your program. Any other questions? Thank you.
Thank you.